Hello, everyone. My name is Zachary Brooks from UGenome. We make genomic medicine personal and accessible for everyone. I'm really excited today to be able to have a conversation with Dr. Jaden Lee, who's the Chief Genomics Officer for UGenome. So, Dr. Lee, Jaden, how do providers choose a drug for a patient? So maybe this is more a question about what's the current standard by which a physician, actually in this case for you, a pharmacist, would think about how to match medication to a patient and that patient's needs.
So right now, typically what happens is many providers, they have sort of their favorite medications. So they will, of course, take into considerations many factors that the patient present with. So you will look at their age, gender, their kidney function, liver function, comorbidities, and of course, financial situation. And you will consider multiple factors to choose the best medication for that patient. However, a lot of that information still comes on a population level. So, typically you have hypertension, or let's try this medication first. So you sort of have your go-to medication. And when that medication does not work, you will go to sort of your second option and next option. So we are usually providers, with lots of evidence on a population level. We try to pick the medication that works best for that specific population. But once again, if that doesn't work, we just also come back down to sort of a try and error approach. But many times, many drugs do work for patients, but they respond differently. So providers definitely take that into consideration. And sometimes it's really coming down to financial reasons sometimes. When patients cannot afford certain medications, you will actually have to choose a medication that is more affordable. So there are lots of factors that the providers will consider when they choose a drug.
Yeah, so it sounds like a couple of things. One is that providers do lots of personalization as much as they can anyway, and pharmacogenomics is an additional tool to make personalized medication a reality for that particular person with their very specific needs and way they react to drugs. I mean, conceptually, the way I think about this is if we have an Excel spreadsheet with 8 billion entries, the population of Earth, or we can have an Excel spreadsheet with like 25,000 different tabs, and each of those tabs represents a smaller group of people. And eventually we could have 8 billion tabs for each person on Earth, their particular genetic profiles understood in terms of their medication response. So that seems like providers are going to have more tools going forward. Is that what you would say?
Yeah, pretty much. That's exactly right. We have lots of evidence with lots of information that will help choose best medication, and pharmacogenomics, it will be an additional tool that will help you choose the best medication for the patient.
Excellent. Thank you.